Wednesday became one of the most important and most demanding days in Jackie's medical journey. After new blood work showed that her anemia had worsened, veterinarians moved forward with two advanced procedures, a contrast CT scan and a bone marrow biopsy. Jackie had to be placed under anesthesia. Hours later, the Ohio Raptor Center shared one encouraging piece of news. She recovered well from the anesthesia and returned to her recovery enclosure, where she was receiving supplemental oxygen. But the biggest question remains unanswered. What is causing Jackie's body to struggle with severe anemia? Tonight, we will separate what has been officially confirmed from what remains unknown, explain why these tests matter, and look carefully at what may happen next. This is the Jackie Recovery Update, where every update is divided into 4 parts: the verified facts, the medical meaning, the timeline, and what to watch for next. No rumors, no premature diagnosis, just the clearest picture available from official information. Here is what has been officially confirmed as of August 6, 2026. Earlier this week, Jackie's packed cell volume, or PCV, fell to 13%. PCV measures the proportion of the blood that is made up of red blood cells. Because red blood cells carry oxygen through the body, a falling PCV tells the medical team that Jackie's anemia has become more severe. After receiving that result, her veterinary team moved quickly to perform additional advanced diagnostics. On Wednesday, August 5th, Jackie underwent a contrast CT scan and a bone marrow biopsy. Both procedures required anesthesia. Her veterinary team, scientific advisory council, and consulting specialists are now reviewing the new findings together with her previous test results. According to the Ohio Raptor Center, Jackie recovered well from the anesthesia and was returned to her recovery enclosure with supplemental oxygen. Additional laboratory work is still pending, and this point is extremely important. No final diagnosis has been announced. The procedures gave Jackie's medical team more information to examine. They did not automatically provide an immediate answer. So now we know what happened. But what do these tests actually tell the doctors? Let's take a closer look. What does a PCV of 13% mean? Imagine a small tube filled with Jackie's blood. After that tube is spun in a centrifuge, the red blood cells settle together at the bottom. The percentage of the tube occupied by those cells is the packed cell volume. In healthy birds, PCV values are commonly much higher than 13%. Ohio Raptor Center previously explained that a typical healthy adult bald eagle may have a PCV roughly in the range of 35 to 55%. That comparison helps explain why the veterinary team is taking Jackie's anemia so seriously. A low red blood cell level can reduce the body's ability to deliver oxygen to muscles and organs. It may contribute to weakness, low endurance, and difficulty coping with physical stress. But PCV alone does not explain why the anemia is happening. It tells doctors how serious the shortage is. It does not tell them whether red blood cells are being lost, destroyed, or simply not being produced quickly enough. That is where the newest tests become important. But why a contrast CT scan? A CT scan creates detailed cross-sectional images of the body. Unlike an ordinary external examination, it allows veterinarians to inspect internal structures from many angles. The use of contrast material can make blood vessels, organs, and abnormal tissue patterns easier to distinguish. In Jackie's case, the medical team has not publicly stated that the CT found a particular lesion or disease, so we should not claim that it revealed internal bleeding, a mass, organ damage, or any other specific abnormality. Instead, the safest interpretation is this. The contrast CT gave specialists a more detailed opportunity to search Jackie's body for physical clues that could help explain her illness. They may examine the images for changes that were not visible through earlier examinations or simpler imaging. But the scan must be formally reviewed and interpreted alongside her blood work and clinical history. The fact that a CT was performed tells us the investigation has become more comprehensive. It does not yet tell us what the scan showed. The next question, why examine the bone marrow? Red blood cells do not appear from nowhere. They are produced inside the bone marrow. When anemia persists or worsens without a clear explanation, examining the marrow can help veterinarians investigate whether the body is producing blood cells normally. A bone marrow sample may allow specialists to study the number, appearance, and developmental stages of blood-forming cells. Broadly speaking, it may help them distinguish between different types of problems. Is the marrow responding to the anemia by producing replacement cells? Is production reduced or disrupted? Are there signs of inflammation, infection, abnormal cell populations, or another process affecting blood formation? These are general reasons veterinarians examine bone marrow. They are not a list of diagnoses that Jackie has. A bone marrow biopsy does not mean Jackie has cancer. It does not mean her marrow has failed. It means her doctors need direct information from the place where new blood cells are made. The laboratory must prepare and evaluate the sample, and the findings then have to be compared with her blood smears, PCV pattern, imaging, and response to treatment. That is why the result may not arrive immediately. Here is the clearest way to understand Jackie's condition tonight. We know that her anemia worsened. We know that her PCV reached 13%. We know that veterinarians performed a contrast CT scan and bone marrow biopsy. We know that Jackie recovered well from anesthesia, and we know that additional results are still being reviewed or remain pending. What do we not know? We do not know the final cause of the anemia. We do not know what the CT images revealed. We do not know what the marrow sample will show. We do not know whether Jackie will need another transfusion or a major change in treatment, and no timetable has been announced for her release. Any claim beyond those facts would be speculation. So, what's next? The next major update may contain several kinds of information. First, specialists may report findings from the CT scan. Second, the laboratory may describe whether Jackie's bone marrow appears to be producing blood cells appropriately. Third, her veterinary team will continue tracking her PCV and other blood measurements. The trend may be just as important as a single number. Does her red blood cell level stabilize? Does it begin to rise without another transfusion, or does it continue to fall? The team will also watch Jackie herself. Her breathing, alertness, appetite, posture, strength, and ability to perch comfortably. A bird can appear bright and responsive while still facing a serious internal illness. That is why visible behavior and laboratory results must be interpreted together. Even after a diagnosis is found, returning to Big Bear would require more than simply surviving the illness. Jackie would need to recover enough strength, endurance, and flight ability to function safely as a wild eagle. For now, diagnosis comes before any realistic release timeline. August 5th did not bring the final answer everyone hoped for, but it brought new evidence. Jackie's medical team can now look inside her body in greater detail and examine the place where her blood cells are produced. She endured anesthesia, completed both procedures, and returned to her recovery enclosure. That is encouraging. But it should not be confused with a complete recovery. Jackie remains in a serious and still unexplained medical situation, surrounded by specialists working through every available clue. Until the pending results arrive, the most honest update is also the simplest. Jackie made it through a difficult day. Her doctors know more than they did before, and the search for the cause continues. We will return when verified new information is released.